I think one of the most common mistakes that we really try to address in our classes and to make sure that our graduates really focus on is communication. I've been very happy over the years to see that American Heart Association has really been focusing on that, mainly because you can be totally up to date on all of the latest data, provide outstanding CPR, but if you're not communicating as a team and making sure that you as a team leader are not setting the tone, you're not going to have as good of outcomes. So that's something that we really focus on, because if things get chaotic or the communication is not there, ultimately outcomes will suffer. Staying up to date with current practice is one of the most important things that we focus on here at Cascade Training Solutions. As many of you may have taken courses before, you know that things change over time. So we have advances in both technique as well as medications. We really focus on trying to make sure that we are maintaining the most current AHA guidelines, and that can change over time. So there's a very regimented way that things go from being from basic science all the way to current practice. And that is something that we really make sure that we stay laser focused on so that we can provide the best courses that have the most up-to-date information. One of the things that sometimes comes up in a resuscitation situation, which can be somewhat chaotic, is that you can have some discrepancies amongst the teammates. That's something that's actually been addressed with the current coursework. And the key is to have really effective communication, because you can find out that there can be some errors. Somebody might mishear what you say. You may be off by one step in what the next step should be, and people should feel comfortable stepping up and speaking their minds about that. If, however, it's a situation where you know that you're going along the right course, the time for that is afterwards. So it's really important after the resuscitation to have a good meeting about that and kind of have an after-action debrief so that everyone can be on the same page. If there's opportunities for education or improvement, that's an excellent time to do that. And that's something that we go through in our courses as well.